Hello, welcome back to our videos on how to help our suicidal friends. Today, we're going to be working on how to start a conversation with our suicidal friends so that way they can give their thoughts, their reasons, and their story about why they are feeling suicidal. First place to start is we simply just want the person to narrate their story. We want to ask them how they got into their current situation, and they may start anywhere they like within their story. But you want to encourage the person to flesh out any extra detail and parts where you feel that the story is lacking information. But the main goal is to simply seek understanding. We also want to encourage the person to continue as much of their story as possible, simply by saying, well, what happens next? What did you do? Why did you do this? We also want to be asking a person how long they've been having suicidal ideation and how recently. Have they been having it within the past 24 hours, 48 hours, the past 2 months? You get the general idea. We also want to know if the person has been engaging in any form of self-harm. Ask very simply, have you been cutting yourself? Have you been trying to choke yourself, hit your head against a wall? Just simply ask, hey, have you been trying to hurt yourself? We also want to be asking if the person has attempted suicide before. Approximately 65 to 70% of people who survive a suicide attempt will be at elevated risk of trying again, especially if their survival includes having regret for surviving or feeling shame for simply thinking about suicide. Nearly half of those who survive a suicide attempt will end up with PTSD or post-traumatic stress disorder. In those cases, you're definitely going to need to refer the person to a therapist to get them within a trauma-informed therapy program. You also want to be very open with the person that they probably have a higher potential for relapse and that it would be advisable for them to try to seek help. If the person is feeling shame for being suicidal, the shame may initiate a feedback loop, where when a person engages in suicide and survives, they feel shameful for simply having suicidal thoughts, especially if they're judged by their culture, especially if they grew up in religion and they're taught that it's extremely horrible to even be suicidal in the first place. If they survive and feel shame, that may encourage them to try to commit suicide again, and then the entire cycle would repeat once again. Attempt, shame, shame leading to another attempt, and so on and so forth. We also want to be looking for any mental imagery that the person has been having recently. Does the person imagine, daydream, or rehearse a fantasy about dying? Do they have a specific method, time, or place in mind? The more often such imagery is rehearsed, then the more likely the person is going to become desensitized to suicide. Some people fear you're going to call the police or a psychiatric hospital on them. You need to be very clear with them that you're not going to divulge any of their information to anyone without their permission, except in very serious emergency circumstances. What would you consider emergency? If you know they're definitely going to start killing themselves right in front of you, or if they're leaving you and you know that they have a plan in mind that they're going to act out. If you don't establish that trust with them first, they're going to view you as an obstacle or as an opponent. You want to emphasize having an alliance with them and also openly discussing your goals for them. Find common ground and treat the situation as a collaboration. You never want to force the person to do what you want them to do. This means no forcing promises, no giving ultimatums, no making them sign no suicide contracts, and no forcing hospitalizations, unless again in an emergency scenario, at any stage of this process. Do not force a situation on a person, but collaborate. That is the bottom line. Now, typically, you may want to have your friend have help from their family or other friends, depending on how familiar you are with their family and friends and whatnot. In this case, you are also going to need your friend's permission. You want to ask them, hey, can I go talk to your family or to your friends so that way they can watch over you on this? Are they aware that you're feeling suicidal? Because you're not going to be there all the time to help them. It's much better if you have other people helping you out, especially if you can also get a person to a doctor. There are a couple of methods we can use to help a person open up, to make it easier for them to divulge their suicidal thoughts without dealing with too much resistance from them. One tactic is to use normalization, which is simply to explain to the person that the thoughts that they're having are normal for many people, especially in circumstances that are very similar to what they are experiencing. To be very clear here, we're not saying that it's normal to commit suicide. We are saying that it's normal to feel horrible in these situations and to be motivated to commit suicide, that they're not the only ones who experience it. That goes into the next little trick we can use, which is called shame attenuation. A lot of people feel ashamed when being suicidal, especially, again, as I mentioned before, because a lot of cultures frown upon it. What you want to do is simply point out that it's not their fault for feeling this way. It is the result of their circumstances or potentially even of a mental illness that they might have. Again, do not judge them. Just explain that you would understand that they would definitely feel this way given the circumstances that they find themselves in. Another thing we can look for is we want to be able to ask if the person has done anything specific, like very specific scenarios. For instance, have you cut your wrists? Have you tried to drown yourself? Have you tried jumping off a really high place? The reason why you would want to do this is because it's a lot harder for a person to lie or to say no to a very specific question you offer them. Another thing you want to be doing is doing a behavioral chain analysis. The way you do one is you're looking for all the causal links that led to a suicidal episode. You ask them what emotions they were feeling, what thoughts they were having, and what behaviors they were performing at the time. Look for any triggers that were in their environment. Was there something that was causing them stress? Did they have a personal belief that they were reiterating to themselves over and over again that made them feel bad? Did they have a very particular emotion that they were flooded with that they couldn't control and made them feel horrible? The idea is to simply trace the pattern of causes that led up to the event. Throughout this entire process, you do not want to try giving advice to your friend or to try to fix their problem. At this stage, you just need to empathetically listen to the person. Your first impulse may have you want to counteract or condone their thoughts and behaviors, but this will most likely only alienate the person. Initially, you are not there to persuade them out of suicide or to tell them that things are going to get better. You need to understand them first. Counterintuitively, you want to actually let the person try to persuade you that suicide is right for them and their only solution. Summarize and restate their reasons and ask if you understood them correctly. Now, this doesn't mean that you actually need to agree with them. The point is that you want to be able to validate and understand their wish to die in the context of their circumstances. If you allow suicide to be a valid option to them, it becomes a lot less likely for that person to fight back with you, and they'll be a lot more willing to consider other options.